Hello everyone, Alan Kopic here, founder of Adminologybay, with another addition to our bundle of value for hospitals and provider organizations who are trying to keep up with the fast pace of change in today's healthcare. Our goal is to find where the innovation is happening that can strengthen your organizations and then deliver it to you so that you can not just survive, but you can thrive. Recently, we partnered with Bill Dunbar and Associates, or BDA, in Indianapolis, Indiana, to help bring their innovative services to the healthcare marketplace so that providers can deliver more value to their communities. And I was able to spend some time with the BDA leadership team, CEO David Dan, National Director of Business Development Terry Scales, and Chief Operating Officer Cheryl Carr, to learn more about their unique approach to helping provider groups navigate these times of hyper change in healthcare. Healthcare leaders and physicians know that oftentimes we don't get paid for the full scope of the work that we do for our patients. Take a listen to how they characterize the special work that their team does. David Dan, you're the CEO of Bill Dunbar and Associate. First question I have for you all is, what are some typical findings that you see when you go into a new client relationship, into a new organization?
Typically, what we're really trying to do is find incremental revenue. And that's something that I think every administrator and CEO is looking for, particularly as we're looking at reimbursement pressures in the industry and reductions in reimbursement.
Right.
What we're really focusing on is finding an easy way that's repetitive and consistent that our clients can use that will improve their net revenue. Not just their gross revenue, but the revenue that they actually will realize in cash.
Terry, where do you focus first? And when you go into an organization and try to figure out what level of benefit can you bring to that organization, where's your first focus? What area of the hospital?
You know, a quick area to take a look at is the emergency department.
Right.
Sometimes we look at the facility component, and doing a free preliminary analysis is the best way to do that.
What do you need from the hospital to be able to do a preliminary analysis, and what's the cost associated?
It's very simple. We've streamlined it where we ask just a few financial questions, but yet we've asked for a few data requests of 5 charts.
Five
typically.
charts. And you had to have a business associate agreement for the charts to be covered, et cetera.
Exactly.
And that's fairly easy. Are you open to signing the organization's BAA?
Many times we do, yes.
I got you.
We
So that
have
even
one.
makes it even more simple. Cheryl, what are some thoughts from your side as the Chief Operating Officer of initial findings from when you engage with a client?
Often we find revenue that they're missing on the table from the services that they're already providing,
Right.
that they had no idea. So helping them realize that increases their revenue immediately.
What are some typical areas that you see really could be improved and need to be improved?
Well, the levels of service, the acuity levels in the ED are usually undervalued. The nurses are providing a lot of services, but the service level build doesn't support it.
What are some reasons for that? Just curious from my standpoint.
They've had the same system in place for years,
Ah.
and they don't have the experience, understandably, they're nurses.
Yeah.
So we want to ensure that what they're providing is reflective in the level of service, which impacts our revenue.
Right. And David, you probably know this too. As a hospital CEO, all I wanted to make sure that was happening was that we were going to get paid for what we did.
Exactly.
And many times if we're not. So,
Right. And what makes us unique in that is that we have a proprietary point system that we use. So we'll look at their point system, and we'll oftentimes offer an alternative point system that will allow them to simplify the process but optimize the value. And that's really what Cheryl was alluding to.
Nice, nice. So Terry, areas for improvement that you kind of see when you go into a new organization and uncover some of the opportunities, if you will?
Exactly. There's several areas where we're looking at nursing documentation, just to making sure that what the nurse is doing is getting into the note. Is there areas that we need to focus on start and stop
Right.
for certain procedures, making sure the times get documented. So if it wasn't documented, it wasn't done. So it's hard to capture
Wow.
those codes that go out on the claims.
In your mind, since this is a complicated area, documentation followed up by coding what was documented, is this something you can educate people on one time and then they just get it? or does education kind of have to be done on a regular basis and in targeted fashion once you uncover? What are your thoughts?
It's a regular basis. You have staff changes that are constant. You have requirements that change on a regular basis. So we're there making sure the organization is always on top of everything.
I was a customer of BDA before I became an owner of BDA.
Right.
And when I was a customer, what we were really looking for was a way to provide a consistent, repetitive approach. And the thing I liked about Bill's approach is it was ongoing.
Right.
And the other thing was that he was willing to take risk.
Yeah.
So from my point of view, if it wasn't going to cost me anything, but I was able to just enjoy the upside, it made a tremendous amount of sense. So we've kept that model really for the last 20 plus years.
Wow.
Where we work on a gain share approach. And through that approach, it incentivizes both parties to implement the recommendation.
So when you encounter client relationships and you're maybe digging into a new organization somewhere where you've not been before, inevitably it happens. You ask the question, in your own mind, you say, if they only knew what they don't know, we could help them so much. What are some of those things that the CEO doesn't know about my own documentation, my own coding practices, and it just has missed me? It's been over my head, it's been in the background, and I really need to pull it out into the foreground and deal with it.
From a non-coder's point of view, I would say this, having been a past CEO, is that you tend to feel that everything's being done correctly, and that the process is just working. What you don't know is that you're probably leaving money on the table because the processes you have in place could simply be tweaked, or sometimes it requires course adjustment, but more often than not it's about tweaking things. They already have good people who are doing good work. Yeah. And what we're really doing is adding value to what they're doing and bringing in resources that we have and experience that we have nationwide.
And that initial preliminary analysis gives them a snapshot picture of how they're doing right now. It's at no cost to them. They just gather the few questions, the few data from the questionnaire and submit that to us. Usually takes us about 10 to 14 days, business days to process it. Fantastic. But we get that back to them. And then they get a snapshot of how their organization currently looks that from an evidence-based point of view, correct? Correct. And a curious thing, we were talking about benchmarks earlier. You all are kind of the ones providing the benchmarks in this space. There's not a lot of national benchmarks out there for ED facility revenue sources, correct?
That's correct. Yeah, we've created and compiled a database for since 1988. And what we really have done is when we go into a specific emergency department, we look and see what are like EDs, similar size, similar mix, etc. Then we'll lay that out as the proprietary curve. We'll lay their information against that, and we can tell them whether there's an opportunity from 40,000 feet, and then we'll look at charts and get into more of the detail.
Fantastic. Cheryl, so to you, the question, I'm the hospital CEO, and you go home after that presentation, you say, if Alan only knew what he doesn't know, what are those things?
It really goes to, we can help with the revenue, but in the end it's compliance. Yeah. So everything is driven based on compliance. So what they're doing today is great, but we can not only increase the revenue, but we can also ensure it's always compliant.
And you think I might sleep better at night if I'm more confident in my compliance.
Yeah. That's right.
Yeah. Fantastic. So you heard them mention their no cost, no obligation preliminary assessment. And they can perform that in about 14 days from beginning to end. In the preliminary assessment, they analyze your results from macro level data, as well as a handful of commercial patient charts. And at the end of the assessment, you'll see how your team's performance compares to what they call the BDA Curve. These data are their proprietary benchmarks in key metrics for the facility fees, not the professional fees, for your commercial billing. You can think of BDA as your partner for outpatient CDI, or clinical documentation improvement. Hospitals have known for years the importance of a focus on the documentation for the inpatient side of their business. BDA brings the ability to focus on the outpatient documentation as well. Emergency department and the clinic setting, understanding the important role your documentation plays in these outpatient settings can be transformative. If you would like to have your team's performance measured against the BDA curve, to see if you might have some opportunities to explore further with them, just send an email to info@adminologybay.com. That's info@adminologybay.com. They'll arrange with you either an on-site or virtual presentation with the BDA team, and then you can decide whether you want to move forward with their 14-day preliminary assessment. They'll make the process as easy as possible, and you'll be more confident than ever that you're actually getting paid for what you're doing for your patients every day. Adminologybay will continue to find where the innovation in healthcare is occurring as we continue to inject value into healthcare. Thank you.